A public health crisis in Australia's far north is causing concern to doctors after Queensland Health abandoned a decade-long program to treat tuberculosis in the islands of the Torres Strait. A dangerous new drug-resistant form of the disease has emerged, and specialists fear it may spread to the mainland after the closure of TB clinics this week. Peter McCutcheon reports.
Dr. Stephen Vincent is preparing for the end of an era. He's about to depart on his last journey to the outermost islands of the Torres Strait to hold tuberculosis clinics for Papua New Guineans.
I think a short-term burden has been lifted, but we're not sort of patting ourselves on the back at the moment. We're just going to keep an eye on things.
For the past decade, Queensland Health doctors have been flying to Australia's northernmost islands to treat PNG nationals in order to stop the spread of a highly infectious, drug-resistant form of tuberculosis.
The chest against here, chin on top.
But the Queensland and Australian governments have controversially decided to stop these clinics, leaving responsibility for controlling this potential public health disaster to their third world neighbour.
We've made a long-term commitment to work with the PNG health authorities and specifically with the health authorities in Western Province.
We have the capacity to manage all our TB cases as well as medical cases on our hand.
But Dr. Vincent isn't so sure.
Any slip in one of the cogs can easily create the whole thing to fall apart.
Queensland Health doctors first set up outreach chest clinics 10 years ago on Boygu and Saibai Islands, a short boat trip away from impoverished PNG villages with little or no access to medical services. The nearest hospital on the PNG side of the border was on Daru Island, hours away by boat and hopelessly under-resourced.
The only way to really treat these people legally was to set up clinics on the outer island, and we knew right from the start that PNG unfortunately had no capacity whatsoever to be able to manage this highly infectious disease.
And managing this disease is complex and time-consuming. Juby Mapi is a PNG fisherman who was evacuated from the outer Torres Strait to Cairns nearly 12 months ago.
When I arrived here, I was so sick and, I had no build. I was just like, a stick or something. And I came in here. Hello, how are you?
Good, thank you, yourself.
He has to take up to 16 pills a day to keep his drug-resistant TB under control. And he's now expected to make a full recovery.
I was very scared, what would happen to me. But I thank for the nurses and the doctors, what they did to me. So
he's done well. We picked him up, he was extremely thin, unwell. He would have been weeks off death if he wasn't treated.
But it's not only PNG nationals who are threatened by this disease.
How confident are you that drug-resistant TB hasn't got into the Torres Strait Island population?
I'm pretty certain that it has got into the population of Australia. We haven't confirmed any cases, but I suspect that there probably are patients up there who have contracted the disease, are not unwell, and it'll probably declare itself in the next couple of years or so. So we're going to keep a very close watch on that.
An aid package has been put together to help PNG manage its tuberculosis problem, which the World Health Organization has described as a crisis. Last month, celebrations were held on Daru Island to mark the handing over of an ambulance boat and specialist TB equipment for Daru Hospital as part of an $8 million AusAid program.
It is a very big step forward, and it is a very big bonus for Daru Hospital, the people of Western Province, and this will also build a confidence in our health system in the province.
Western Province borders on the Torres Strait parts of Australia, and we have a very strong national interest in working with the PNG authorities to get this TB issue under control.
Dr. Vincent says although the AusAid program is encouraging, he'll be maintaining a watching brief.
We do have concerns that there's no plan B. That's our main worry at the moment there. We know that if any of those issues fall apart on the PNG side, then the whole TB program once again can fail.
Peter McCutcheon reporting.